Namaste and welcome. Welcome to Vivekananda Yoga University, the first yoga university out of India, doing graduate education research. Good morning, good afternoon, good evening, wherever you are. Thank you for giving part of your Saturday here to be with us for this Distinguished Speaker Series webinar. And we're delighted to have a distinguished speaker here, Dr. Lauren Fishman. So let me introduce our speaker. It's really, again, an honor to have Dr. Lauren Fishman. He was here in 2024 to talk to us about, yoga therapy, gets an A+ grade. So right now he'll be, so let me first introduce him as a speaker. Dr. Lauren Fishman, in over 2 decades of practice, has gained an international reputation as a back pain specialist, a diagnostician, and a pioneer in the treatment of many disorders, including piriformis syndrome, scoliosis, osteoporosis, and rotator cuff syndrome. He has authored more than 90 academic journal articles and 10 books. His books on osteoarthritis and osteoporosis guide the workshops that he conducts nationally and internationally. He has been trained actually by the master himself in B.K.S. Iyengar in India, and he uses those techniques in his rehabilitation practice and has written extensively around yoga as an adjunct to the medical treatment. Again, a lot to share about him, but and you can read up on him on sciatica.org, which is his organization that he runs. He's also a assistant professor at the Columbia University Medical School. Today's topic is again very interesting. It has an intersection of yoga therapy, science, and peace on the topic of osteoporosis. So he'll be talking about new research or these slow conscious yogic practices that help in terms of the prevention, reversal, and yoga therapy is a holistic evidence-based modality for prevention, reversal of chronic diseases at the musculo-skeletal level. Certain yoga poses have already shown to raise bone mineral density and thus prevent fractures. So again, he'll be talking about his cutting-edge research, and he has a colleague with him as well, Liz Larson. So Dr. Fishman, the floor is yours. Thank you so much for your time, and Liz as well. So thank you.
Okay, well, yeah, so first, hello, thanks, Prashant. I want to introduce Liz Larson. She's my colleague for more than a decade now, and she deserves a medal to be able to work with me for that length of time and preserve some remnant of sanity. So I'm going to go right to the chart. I'm going to show you a video because I think that's the best way to get this across. Now, let's see if I have it here. I certainly should. So here's what we're going to talk about: yoga for osteoporosis. And you see Liz is listed there. These are all the people that have helped me with it. And there are more. I just haven't always put them in. Yoga actually works to reverse osteoporosis. So what is osteoporosis? What I'm going to do is talk to you a little bit about what it is and things that for some of you will be repetition and old hat, but for some will be brand new. And the idea then is to then talk about the 12 poses. Liz is going to demonstrate 5 of them, just a representative group. So what is osteoporosis? It's a condition in which the bones get fragile and bone tissue actually gets reduced. And it's the first diagnosis I know that has a numerical definition. There's a test called the DEXA scan, which I'll show you. And if your score on the DEXA is below -2.5, you have osteoporosis. And if it doesn't, you don't. Simple as that. Pretty nice. And so let's just show you. Here's an example of the microfractures that you see in a bone. You never saw a bone looking like this, did you? This is an osteoporotic bone, looked up very close on what's called the atomic microscope. Well, what a little epidemiology. Over 50 million Americans have it, probably judging that America has about 1/20th of the world's population. That means over 1 billion people worldwide, like 1 in 8. The spine is a fracture every 3 seconds. If you listen carefully, you could probably hear one right now. The wrist is, the spine is the most common, but the femur is the most serious. 25% of the people who have a femoral fracture die. Another 25% never leave the institution to which they are admitted. And the other 50% do recover and go home and resume their previous lives. What's the economic cost? This is a little old. This is from early 2026. Then it was about $31 billion. And the hip fracture, a lot of money. But in their infinite wisdom, Medicare has decided they'd rather pay for that than $125 of yoga. And all you need really is one yoga session, and you learn it, and then you do it on your own. So I say, if you don't know where you're going, then you can't tell when you're there. So what is it? What is it? What is bone first? It's living, growing, dense connective tissue. You don't think of a bone as a live thing, but it is. Uh, a combination of the protein osteon, which is mainly collagen, picks up the various minerals it needs and makes something, a lattice structure, almost like a metal, very hard, and actually lasts very much longer than metal does. How do you tell if someone's got it? This unpronounceable dual energy X-ray, here comes the word, absorptiometry, which estimates your bone mineral mass and compares you to 110,000 healthy women between the ages of 25 and 30. So here it is. Here's the machine. Here's the person getting it. The rays go right through. You see, there's a plate behind. The more X-rays that the person stops, the fewer end up here, and the higher your bone mineral density. The more X-rays that actually get through, the lower your bone mineral density. This is a tech. He's not even wearing one of those lead aprons. It's so low in its irradiation that they do it. Even people that do it all year long do not need to wear any protection. So here's what you get when you look at those 120,000 healthy women. You get a normal distribution. So here's the mean. Some are better than the mean. How many? 50%. How many are worse than the mean? The same amount. So they've artificially defined osteopenia as being one standard deviation, a measure of the spread of this distribution. So that someone who has osteopenia has 50% plus 34, 84% worse. His bones or her bones are worse than 84% of the population of healthy young women. Osteoporosis, that's 2.5 standard deviations, and more than 99% of the people have better bones than that person. So this is how your bone density measures up to 25 to 30 years old women. It's called the T scale. Let me show you. This is the T scale, and this is what I'm showing you here. There's also something called the Z scale, which is how your bone mineral density measures up to other people your own age, your own gender. Some do it by location, Asia versus Africa versus the rest of the world, really, and other things. But these are peripheral studies. The real one is the T score. So 1 in 4 men over age 50 and 1 in 2 women over age 50. It's more common than prostate cancer for men over 50. A hip fracture, the risk of a hip fracture is greater than the risk of prostate cancer. And the mortality from hip fractures is higher in men than in women. In women, it's about twice as common. And the risk of a hip fracture is equal to breast plus uterine plus ovarian cancer in women over 50. It's not rare, in other words, far from it. Here's a graph showing, it comes from a drug company, showing the risk of fracture. I just want to give you some feeling for this. Person who has a person who's 60 years old, who has a +1 DEXA scan versus a person 60 years old who has a -4 DEXA scan reading. That's a difference of 186 times more likely that someone with the -4 will get osteoporosis than a person with +1. And it's the same thing as the 10-year probability of a hip fracture is the same. Look at that. So it does correlate pretty well with fractures. Here is a drug study. This comes from a drug company too, just to give you what they say. This is Boniva. Now here's the red line is the placebo. They actually got a little better, but they didn't get much better after the first 12 months. Probably they lived better up there because they knew they were getting some medicine. But the people that got the Boniva, look how their bone mineral density took off and really zoomed up. And this is for the spine, and this is for their hip. But I want you to notice something else. After 2 years, 24 months, well, they're not shooting up at that rate anymore. It's slowed down considerably so that by 3 years, it's almost flat for the spine. For the hip, my goodness, it just about is flat. In other words, you're not gaining any more bone at all after you take these medicines for 2 years. The third year, not so much is happening here, not so much. Here is showing you that the medicines really do work. They reduce your fracture risk by about a third. I mean, this is two-thirds, 2 times 14. This is 3 times 14. It's just about exactly that for the hip, for the spine, and all the others put together. So it doesn't, but however, the medicines have not such great effects as well. I'm just giving you all the different medicines here. There are a number of medicines called bisphosphonates. There's an endocrine one called Vista. There's one that stimulates your parathyroid. In fact, there's one that is an antibody to a medicine that stimulates the cells that eat up bone. So it deactivates the cells that eat up bone. Here's one that does both, stimulates your bones and stops the ones that eat up your bone. And strontium, it's a mild one. It's sort of in the periodic chart. It's in the same place as calcium. So it looks a little like a lot like calcium, but it's a little different. They all have terrible side effects. Note the prominence of cardiovascular disease, that's your heart, and deep vein thromboses. I'm not going to go into detail. Just Fosamax. And this is not all of them. Vomiting, death of a bone, swelling, convulsions. Now that's no fun. So let's see. There's recently it's come out that Forteo produces a 40% increase in heart attacks. So they're not so great. And if you compare this medicine, this is Fosamax, one of the bisphosphonates. You see, the list goes on. It doesn't end here. On my little 13-inch MacBook, it goes down 14 inches. I measured it with a ruler. All side effects. Whereas yoga improves your posture, your balance, increases your range of motion, raises your strength, refines your coordination, and lowers your anxiety. So these medicines do none of that. Find me a medicine that improves your posture or or gives you finer balance. There ain't none. So yoga has certain advantages, particularly when it comes to falling. So let me go on. The medicines are problematical, and there's a really good scientific way of showing this that I'm not going to be able to give you because we don't have time. But I can just sum it up briefly. The fractures occur with two things. They occur with poor posture, where you're slumped over, and that affects your spine, and with falls. That can obviously injure anything. I don't have the ribs down here, but they should be. So how does yoga prevent the fractures? It improves your posture. It reduces the risk of falls in the first place through all of these means, and it strengthens the bones. So that when you do fall, you're likely to resist a fracture. Now, you may say, well, there are medicines that lower your anxiety. Come on, Dr. Fishman. And there are, but they impair your balance, like Valium, for example. So how does yoga build bone? You guys want to know, okay, I'm talking about it. What does it do? And here again, I'm just going to summarize a lot of excellent replicable science, replicated actually science. It all follows Wolff's law, developed by a surgeon and anatomist in the 19th century. I can't even tell you the story, which is a lovely anecdote. But here it is, the architectonic of bone, that is, the underlying structure, the support of a bone, follows the lines of force to which the bone is exposed. So if you're always walking and putting pressure on your femur, then you're going to grow bone on the inside of that femur. Where you swing the other leg, the pressure is going to be on the inside of the bone. That's an example of it. Now, muscles are stronger than gravity. I don't know if you believe that or not. I don't know if you recognize it. Yoga is actually, that the muscles actually generate. I can't ask you to vote, but vote in your own minds. What's stronger, muscles or gravity? This great big planet of ours. Muscles are stronger than gravity. Do you want me to prove it to you? This I have time for. Are you ready? Are you set? Here we go. Of course, muscles are stronger than gravity. That's their whole point for moving around on our little planet, you know? That's what they do. So in yoga, you oppose one whole group of muscles with another. For example, in Supta Padangustasana. So the asana stretches bones and stresses them much more than gravity. So if gravity can produce, can be an antidote for osteoporosis, well, yoga can do it more so. And that's exactly what we find, is that yoga does it more than gravity. And it does it more than the medicines in many respects, too. However, here I am bragging about it. As Lanyon said almost 40 years ago, there is nothing that dooms a good idea to lack of acceptance faster than overambitious claims by its protagonists. And you see this in yoga all the time. You know, the ancients said it, this pose banishes death. This pose causes the gastric fires to rage. This pose, you need fear no beasts. There are all kinds of things that have been said. But what about yoga and osteoporosis? Well, I did a pilot study because my friends said, you're going to teach yoga to people with osteoporosis? Lauren, you're crazy. You're going to break their bones. So I did a pilot study in my office. Won't tell you the details. Here's the control group that got no therapy at all. In the course of 2 years, I taught them yoga 1 day a week after I was done with my patients. The spine, they lost a little bit of bone, of course, and in their hip, they lost a little bit of bone. Well, here are the yogis. They gained for the spine, they gained more than half a point. And for the hip, if you add up what the others lost and what they gained, it's almost an entire point. Say they would have gone from minus 2.5 to minus 1.5. No more osteoporosis. So here's the big study we did, 741 people. About a third of them actually did the yoga the way they were supposed to. And these little parentheses are the limits of confidentiality. And you can see that this was highly significant. It's 0.001 that the yoga did better than placebo. This we measured them for 2 years before we did the yoga. Then we taught them the yoga and we measured them after the 2 years. So we had 3 points. When they started, after 2 years, they hadn't done the yoga, but they had 2 years for us to see how much they gained. And then we had 2 years with the yoga. We could see how much they gained. Now, the light gray, that's with the yoga. The femur also, here are the confidence intervals, 95%, highly significant. The hip, I was a little ignorant in the hip. I didn't realize that the different machines, the lunar, the other machines, they measure differently. And they come up with different parameters that they measure the hip with. So although they did gain, it was not statistically significant. My next study, the one I've just finished, I was aware of this. So it turns out the hip is every bit as good as everything else. So this 741 people, 85% had either osteopenia or osteoporosis. Their 68.3 years was their average age. And now we have more than 300,000 hours of people doing this yoga and no serious injuries. No fractured vertebrae, no meniscal tears, no herniated discs, rotator cuffs, nothing of any significance. And we took before and after x-rays. We didn't even see the osteoarthritis get any worse than you would expect of people that weren't doing this. So it's safe and it's effective. So if you're interested in our new study, we're going to be starting another one pretty soon. It hasn't even started yet. Or if you want to do our certification course, which will explain all of this and go over the poses in great detail, go to sciatica.org and you can sign up for everything there. And if you want, write to me. You can sign up for my newsletter. And when I do a new certification course, I don't even have one planned yet, but probably in the spring, summer, write to me and I'll put you on the mailing list and you'll know when I know. So let's do yoga. What do you say? Let's do Vrikshasana. In every pose, we do a basic, a beginner pose for people that have never done yoga or who don't have much talent. We have an intermediate pose then that is it's a bridge from the beginner pose to the classical pose. And then we have the classical pose. That's what we do. And we're not even sure which one is always the best. We're really not. And that's what we're doing in the current study. We're trying to figure that out. And I think we do. I'm going to get the results today, guys. It's pretty exciting, but I do not have them yet. They promised to give it to me. Now, Liz is there. Wait, Liz, I'm going to make you big. Are you ready for this? Wait, I think they have control of this.
Diksha, you
Can you
can,
make,
yeah,
can you make
put on
Liz big?
spotlight. Yes. Cute.
There we have her, pretty big. Okay, so Liz is going to begin with the beginner pose. See, her right foot is up on a chair. She's got a wall on the other side and a wall behind her, and her foot is sticking out in front of her. She's pretty safe. People in nursing homes who have osteoporosis can certainly do this pose if they can stand. They don't have to get up from sitting. And Liz can now, as long as she's there and feeling stable, she can raise her right hand off of her knee and up. And then when she really feels well enough to do it, raise her left hand up. So she's straight up doing a very valid, and yeah, USC, they did a study of a pose. I'll show you the pose in a minute, which puts 60% more pressure on the femoral head and the femoral neck. Then for the intermediate version, Liz just turns the chair around and puts one hand gingerly on the top of the seat, the back of the chair. And now she can raise first her right hand off the chair. Up it goes. And then her left hand. You see, her left foot is kind of congruent with the inside of her thigh and her calf there. She can put her foot below the knee or above the knee, but she shouldn't put it on the knee. And she can stretch up. And if she can do this, she's still got the wall behind her. She's got a wall on one side and the chair on the other in case she gets topply. But then we can go to the third and, the classical pose. But this pose with Liz's foot just on her calf raises the pressure on the right thigh by 60%. There's a good study using pressure sensors and all from USC that shows this. Okay, on we go to the classical pose. No chair, no wall, just Liz and her refined sense of balance. And now she stretches up like a poplar tree. I'm not sure you can see it, but her palms are together. And she's reaching up, opening, yawning with her armpits till she's way up there, her heel up at the root of her right thigh. Okay, good, Liz, thank you. Now I'm going to go back to, just going to show you a couple more, and then we're going to ask Liz to do another one. And you can see what's happening. Pressure against the femur. This is also a very good warm-up, obviously. What happened there? I don't know. Let's see. Oh, and all kinds of funny things are happening here. There. So there she is doing the pose as you just saw her. Then there's the Trikonasana, where there are also three versions that I'm not going to show you, but I'm going to show you another one that's similar. And here these are the cues. I hope you give these slides to the people that are watching so they can use these to teach anybody if they want to. You press the wrist against the ankle. You produce three triangles here, as you can see. The two legs in the mat, the arm, the leg, and the torso, and the wrist, the ankle, and the mat. Three triangles. You bulge the sides. See how Liz's left side is so straight there? That's the hard thing to do. Then there's Warrior Two, which is also here, and it's a wonderful pose for teaching. But we just don't have the time to do everything. What happens here is that the femur is at a tremendous mechanical disadvantage, being way out there like a flying buttress in a Gothic cathedral. This foot is straight and in line with the plane made by the intersection of the calf and the shin and the thigh. And it's like the architectonic's like a balance. Here are the pans of the balance, and here's the tower that has to be vertical. You can see there's torque on the left calf, and the spine is twisted with lateral pressure. And here's Liz doing the same one. So much to say. Here's Parsvakonasana, where I've got some of the cues up on top too for you to see. Then there's the twisted triangle, the Parivrita Trikonasana. Let's show Liz doing this one. I think this is a nice one to get out there. Wait. I'll end the show here and let Liz be big again. Make Liz big, okay? Have you done it? I can't tell from here, my vantage point. But yes, Liz is there. She's facing the wall. This is the beginner pose. Her left foot is parallel to the wall. The right foot is turned in about 60 degrees. Her arms are out to the side, collinear, one line going through both of them. She takes a breath in, bulges her left side. The left arm goes down and the right arm goes up. The left arm goes down and up. The right one goes up and down. Okay, so there she is. This is a beginner pose. She tries to get her left shoulder blade against the wall. Then she puts her right hand down on the seat of the chair, palm to seat, like this. Then when she feels able, she puts her whole forearm down on the chair, lopping her fingers over the edge, as you can see, so she can pull on the chair to bring her right side forward, and her left side revolves backward, like wheels on an axle. It's that simple. You can see her right foot is almost at least 60 degrees forward, maybe more. Okay, and then that's the intermediate pose. Now, Liz gets rid of the chair. She turns to the other side. Her arms are out again. Now, this time the right arm goes down and then up, and the left arm goes up and then down. Her little finger and her little toe are sort of together. You can see that right foot is tilted in quite a bit. And her left ribs are parallel to her right ribs, and they're both pretty well horizontal. You can see how this would twist the spine. And we found that twisting the spine, when we analyze each pose, twisting the spine seems to be what causes the spinal vertebrae to gain in osteoporosis, to gain bone mineral density. This is probably the best of all the poses for it. Okay, Liz, thank you again. Thank you very much. I'm going back now. And I say to you, beware, caution, destiny is at work here. This is very controversial where we're going with this, but you'll see what it really means. The National Osteoporotic Foundation, the National Board for Osteoporosis says don't twist. You can give yourself a rotator cuff. You can fracture your spine. You can dislocate your hip. You can ruin your cervical spine. This is a terrible thing. If you have osteoporosis, don't twist. You hear me? This is absolutely untrue. As I mentioned before, we have over 300,000 hours of people doing this yoga. I've been teaching it for 10 years. We have more than 600 teachers all over the place teaching this. They report to me, and I especially say, tell me if there's a fracture or something wrong. Not a one. Part of Mr. Iyengar's genius is that he found poses that you can really try hard in without hurting yourself. And this is a really good example. Here's what they say, thou shalt not twist. Twists can do all these terrible things and mess up your SI joints. I didn't even say that. Okay, so now here's from the current study. We haven't finished the analysis, but if you look at the twisted triangle, how much do these poses help your spine? Full study, I got about 0.06 better per month. Doing the twisted triangle 3 times a day, which we had some people do, they get about 7 times that much, no, about twice that much better, a little more than twice. Suptapada and Gustasana, which is not a twist, they also get a lot better. But Marishasana, it's the twists generally that preponderate in getting you better in the twists. And no, as I say, no fractures. So now we're going to go on. Shalabhasana, this is Liz doing the locust. You can see her doing it. I'm going to stop the share and let's make Liz big yet again. There she is. Yeah, good. Yeah. Okay, so here she is. She puts down one knee, then the other knee. So she doesn't round her back going from stand to sit. She lies down, she stretches her left arm straight out like that to lie on her abdomen. And she turns over to lie on her abdomen, puts her hands just below her shoulders, pushes down first passively to rise up. Now, as I've been saying to you all along, passively is not the way to go. But there she is, and now she does this difficult thing. She lifts her hands and tries to maintain her elevation. She almost does it. Very hard to do. To go to the second phase, she puts her arms, this is like a beginner, puts her hands behind her like this and pushes down with her palms. Palm down, even though it isn't classical, seems to stretch the sternum more and exercise the ribs more. Then she interlocks her hands behind her, pushing the thumb side of her hand down towards her heels and brings her heels up close to her hands. This is the classical pose. Daylight underneath her thighs. She's coming up as high as, notice how she rocks when she comes up because her center of gravity is changing. And then, because she's Liz, we do an extra credit pose here. She can bring her hands over her head in super person. There's a wall there, but she's not touching it. Like Batman cruising over Gotham looking for wrongdoers. Okay, back. I'm going back to the. Thank you, Liz. Going back here. Okay, so that's that pose. Then there's another one that we're not going to show you because we just don't have time. This is Setu Bandhasana, the bridge, where Liz can do a couple things here. She can push her feet away isometrically without moving them, and that will bring her chest up even further over her throat. Or she can take her feet and do just the opposite, isometrically pull in, use her hamstrings, which will raise her groins up quite a bit this way. So there are different maneuvers you can do. In our longer sessions, we certainly go over this. Then there's Supta P, Supta Padangustasana 1. I think, Liz, I think we're going to do this one because we did standing pose, a twisting standing pose, and now we did an extension posture, and now it's time to do a stretch. This is basically the only way that you can stretch your spine. Do something like a forward bend. Let's make Liz big again, because this is for Liz to do. She's sitting in a chair. This is paradoxically the most dangerous pose, too, because Liz can draw a bead on her feet and try to get that belt around her foot. And when she does, she leans forward. Look at that crescent moon of a back she's getting. That's the one thing you don't do in yoga for osteoporosis. You don't round your back because it puts weight on the front of the vertebral bodies, which is where absolutely every fracture of the spine I've ever seen that has to do with osteoporosis. So instead, Liz crazy glues her back to the back of the chair to remain there throughout this pose. But then how does she get the belt? She can't see her feet. Well, she can just put the belt on the floor and step on it, or she can fish for it with the logically smallest possible fishing net, one strand. And there she's got it, and she raises up. The belt is just behind her metatarsals, just behind the ball of the foot. She's holding on here. She'd make another mistake and put the belt parallel to her leg. So she's just pulling on her foot, like lifting yourself up by your bootstraps. So instead, she makes an angle here, makes not a trapezoid, but she makes a trapezoid, not a parallelogram. So she's pulling upward. So the whole leg is acting as a fulcrum. To go to the second phase, she walks in on the belt until her elbows are straight, and then she rows the boat, makes her shoulders come back down and together. So she's using the muscles of her thigh as well to elevate the leg. That's all. I think that's it. Go down to the floor now. Let's show them the classical version. Yeah, okay. So Liz can make the same mistake here. She can raise herself up and round her back and these people have stiff legs. So when they straighten the leg out, they're putting a lot of pressure. So don't do that. Instead, let them just lie there and bring the foot to the belt. And see now Liz straightens both legs out. And sometimes you just can't go up any higher than this. Some people can't. So here again, the belt is parallel to the foot, and that's no good, pulling on her bootstraps. So instead, she bends her right knee. That tilts her pelvis backward, and her left thigh comes up further, and she can make the trapezoid. So she's pulling her whole leg. It's acting like a fulcrum, like a lever, like a crowbar, if you will, putting tremendous mechanical disadvantage on the femoral neck and hip, raising the pressure there maybe 50 times, a really lot of pressure. Then when she's able, she can straighten her right leg out again, and then goes up higher and higher, crawls in, rows the boat again, best she can with her elbows straight. And then when she's good enough, she can get rid of the belt and take her index and middle fingers around her big toe and come forward as you see before you. The right back of the right calf is on the floor. All right, thank you, Liz. As long as you're here, why don't we just do Why don't we do Marishasana? And we're going to do 2 twists too. And then here are the twists. I mean, the idea here is that you can't just bend forward to raise the bone mineral density of the front of the vertebral bodies. Mirshid Sinaki at the Mayo Clinic tried it, and she caused so many fractures she had to stop the study, which has, by the way, been replicated, and they had to stop it again. So instead, we use twists to strengthen it. Circumferential pressure. Liz's left thigh is parallel and flush with the wall. Foot is parallel. Got both hands up opposite her shoulders. She pushes with her left hand to get her left shoulder back, which revolves her whole right chest forward. It's the lowest right rib that you should pay attention to here, because you want to revolve the spine, not just the chest. Then she takes a breath in and pulls down on the wall in order to make herself taller, give herself more space. Then she exhales, and the empty space of her exhalation gets filled with what? With her. With her right, the 3 lobes of her right lung, with her liver, with her ovary, her appendix, all right in there. Then she breathes in again and gets taller again, opens up more space, brings her chest off of her pelvis, and then she uses that extra space as she exhales to revolve still further. And there she goes. Now, you know what, Liz? Let's show Matsyendrasana just to show how it works. Same thing. She curls one leg over the other, but the thigh is still flush with the wall. And here she's got a shorter taffy that she's twisting. She's only twisting her spine here. Before, when she was standing, she could bring her hip and her thigh and her flank forward. Here, it's just the spine. So you'd expect this pose to be better at applying pressure to the vertebral bodies. But so far in our testing, it is not. It's the Marishasana that's better. It's just the way it is. Okay, Liz, we can show that. I don't even think we're going to show the complete. I think this is enough to show them. The classical poses are the classical poses. I think I have examples of them anyway. Here's Liz doing Supta Padangustasana 1. Then, of course, we don't just stop there. Why should we stop there? We also do, and here, an interesting thing, Italian study, Visconti and et al. If you stretch your leg that much, then not so surprising, the vascular flexibility in that leg is greatly increased. What is not so obvious, but true, is that it also increases the vascular flexibility in the other leg and in both arms. So there's some humoral element or neurological element that is working. These Visconti and others, they project that and say if it's true all over the body, it's true in the heart and the lungs and the brain. So it reduces the incidence of myocardial infarction, heart attack, pulmonary embolism, and stroke. This was first published in 2020. I'm sure they're doing a study on that now. Anyway, there's Supta Padangustasana 2, where there are tricks that I can't go into right here, but they're there. Here's Marishasana that we were just talking about. See, Liz is making a bandha behind her. Her foot is not stiff, but it is firm, and it is vertical, and her thigh is next to her calf. Then we go on to Matsyendrasana. I keep getting them wrong. Here, it may look like Liz is bent forward, but she's not. We have tricks there, too, to keep you from rounding your back. And then there's Shavasana, which I cannot emphasize too strongly, the bone muscle crosstalk and the many molecular signals that are given from the muscle to the bone and back again, and how the brain actually is critical in the secretion and in the synthesis of so many of these hormone-like proteins that are generated probably through all action, but certainly through yoga. So it's just finishing up on this. The Fosamax has all these difficulties going down 12 inches here. And would you prefer that? Or would you prefer the pleasure of doing yoga, which improves your posture, your balance, your range of motion, strength, coordination, and lowers your anxiety? So I want to just tell you this last thing. Remember I showed you these slides of how the drug companies, the drugs get you really going at first. Wow, they take off like a rocket. But then by the time 3 years are done, they're almost flat. Well, we've got about 20 yogis that we've studied closely enough for 5, 6 years. And it's not enough. That's why I have a dotted line here. I'm really not overconfident of this, but the yoga just keeps on going. And after about 2.5 years, it crosses the path of the medicines. Medicines are better at first, but after 3 years, the medicines are not as good. The yoga just keeps on going, keeps on getting you better and better. That's important because the medicines, only a certain number of years you can take them and then they change you to another one, which has basically the same dismal future. So thank you. Good luck to you all. I'm signing off of this one now, and I wish you all well.